Assalamualaikum warahmatullahi wabarakatuh. We are from Group 56 and will be presenting on our project, Cardiac Rehabilitation Booklet. As a group, we aim to conduct a project that will be significant to a majority of the population. And according to the World Health Organization 2019, the leading cause of death worldwide is due to cardiovascular diseases. While researching on this, we were introduced to cardiac rehabilitation. In a study conducted by Kwan Sehi and colleagues, which is entitled Quality of Life and Awareness of Cardiac Rehabilitation in Patients with Cardiovascular Diseases, it is shown that only 16 out of 53 patients that participated, or 30.2% of them, are aware of cardiac rehabilitation program. This clearly shows that a majority, with over 60%, are unaware with the services and assistance of cardiac rehabilitation. So this leads us to the reason why we as a group wanted to create a booklet on cardiac rehabilitation, which is mainly because we want to raise awareness on the existence of cardiac rehab and also to benefit more patients, as it has been proven that cardiac rehabilitation improves secondary preventive outcomes, and in patients who has ischemic heart disease, heart failure, and who has undergone cardiac surgery, cardiac rehabilitation decreases the rate of morbidity and also death rates. Next, we have three main objectives for this project. The first one being to introduce the existence of cardiac rehabilitation and also inform the public of the importance of the program to patients who has had cardiac events. Our second objective is to inform the public of the goals of cardiac rehabilitation and provide a simple explanation on its course. And lastly, it is to promote the cardiac rehabilitation program delivered by the UITM hospital. For methodology, we first decided on the topic and also objectives of the project. Once these are determined, we proceeded to extract information by means of secondary analysis using books, journals, and also websites. Most of these are accessed online. We then proceeded to arrange the content in form of a booklet by editing the information in form of infographics and also simple explanations. We then proceeded to prepare a 5-minute video presentation, and a report is written and the project is submitted.
So what benefits can be gained from our booklet? First, the general public is introduced to the existence of cardiac rehabilitation program that helps to improve quality of life of patients recovering from heart attack or other form of heart disease or surgery. And next, patients are also briefly enlightened about the phases and components in cardiac rehabilitation program. And lastly, both the patients and public will get information about rehabilitation clinical service provided by UITM hospital. This is the front page of the booklet we have created and the contents of the booklet. For introduction, we introduce cardiovascular disease as one of the major causes of death worldwide. We also include the occurrence rate of cardiovascular disease in Malaysia according to ethnic differences. Next, we explain about cardiac rehabilitation, its objective, and the target group of cardiac rehabilitation program. Phases in cardiac rehabilitation program are also briefly explained in this booklet. The very first step in cardiac rehabilitation program is medical evaluation. In this booklet, we showed examples of assessments that are conducted by a team of healthcare professionals before planning further treatment for the patients. Physical activities act as a strategy to assist patients to rebuild strength and improve their quality of life. So in these 2 pages, we demonstrated several physical exercises that can be recommended to post-cardiac operative patients. We also explained techniques suggested by cardiac rehabilitation UITL, which are the deep breathing technique and progressive muscle relaxation that can help enhance cardiac function. Heart-healthy diet plays an essential role to improve cardiovascular health, and smoking is known to worsen the condition of patients with heart problems. We provide a simple visualization on the concept of suku-suku separuh and means recommendation by the Ministry of Health Malaysia. We also listed 12 tips to stop smoking. Patients suffering or recovering from serious health condition can end up feeling stressed, anxious, or even depressed. So this page shows how cardiac rehabilitation program helps to overcome these kind of problems by offering counseling, meditation techniques, or medications such as antidepressants if needed. In this particular page, we aim to promote cardiac rehabilitation program by UITM hospital. We displayed some of the activities conducted and facilities provided, such as the inpatient and outpatient rehab gym. We also include the contact information of UITM Rehabilitation Clinical Service. In conclusion, from this elective project, our group has gained valuable skills and experiences, such as gathering information from various sources like the books, articles, and journals, and learn how to arrange them nicely to produce a booklet. We hope that our booklet achieve our objective and can be beneficial to the readers. This is the end of our presentation today. Thank you for your attention.